Thank you. All right. So I've chosen to title this "Managing Your Risk" because it seems as though we are at risk, not just diabetes, but other metabolic diseases we are at risk. And so managing our risk is really what we should do to prevent ourselves. It's like prostate cancers in men. Men have prostate, so by virtue of you having a prostate means that you are at risk of prostate cancer. So you ought now to manage your risk. I think this is what is really supposed to be. Just by quick definition, diabetes represents a group of disease that affects how your body metabolizes glucose. And that's really what it is all about. It is important to metabolize and to understand the use of glucose in the human body. Glucose is used for a number of things, but one of the main things it's used for is for brain function, where other organs of the body are able to use other sources of energies like fat and protein. The brain can only use glucose. And so for the brain to function, you actually need glucose. I do recall sometimes when I have a very busy day and I didn't have lunch and I have to go to a presentation or something, I would take with me some fine glucose like glucosate, which is like a refined sugar that can quickly get to my brain. And just one glucosate would keep me up for about an hour and a half to finish my task, and keeps me alert because glucose is really what the brain uses. Excess glucose is stored in the liver as glycogen. And that's another energy source that's there. So that when your blood glucose drops, your body converts the glycogen back into glucose so that you can actually get the energy that you need. And after using the glucose, the glycogen, if your body still needs more glucose, then it converts the fat under your skin into glucose to make you make your brain works. And if you still don't eat, after a while, the liver now converts your muscles into glucose, and that term is called gluconeogenesis. So glucose is a very major part of how we function and what we do. I must say, however, that in Black people, I mean, probably happens in white people as well, but really in Black people, Black people have an interesting way of converting glucose into fat. And I think that's one reason why we have so much problems in our society with being overweight, because of the excess glucose that we consume. And not just the excess glucose, but the type of glucose that we consume. We're consuming a lot of simple glucose rather than complex glucose. And I guess we're gonna have a talk about that as we move along. In the body, the insulin in our body helps us to use up the glucose it's in our bloodstream. Insulin is produced in the pancreas. The pancreas is that little portion of this organ that is right here. I hope you see my cursor. This is the esophagus. This is your stomach here, your small intestine there. That's your liver over on the side. And the pancreas is this little organ right nestled, almost like a mother, the stomach, holding her baby in her arms. This is where the insulin is produced in the pancreas. And that insulin comes through the intestine, gets deposited there, and that helps the glucose that you eat to be absorbed into your bloodstream. This is another little diagram of how it actually happens. This is the pancreas here, causing the insulin to come into your intestine, and so it can get into your bloodstream. And this is kind of a diagram of how insulin helps glucose to get into your body. The blue is considered to be, let me see, the green is insulin, the blue is sugar. And literally, the insulin holds the glucose in its hands, just like a mother trying to take a baby into a house through a door. The insulin is like the mother, and the baby is like the glucose. The mother holds the baby in her arms and take her across the doorway into the house. And literally, that is how insulin works with glucose. Insulin holds the glucose by the hands and takes it across the membranes of the cells into the cells of our bodies. And so that is how insulin works. So for this reason, it helps you now to understand what causes diabetes or what causes high blood sugar in your bloodstream. High blood sugar in your bloodstream is when the insulin is unable to hold that glucose and take it across the doorway into the house. And because the insulin is not able to do so, a lot of the glucose remains in your bloodstream. And that's why when the doctor do a blood test, he finds that your blood glucose level is high, because the insulin is unable to have the blood the glucose go across your bloodstream. Now, this is actually called insulin resistance. And that's one reason why these days, more and more doctors are encouraging patients with diabetes to go on insulin earlier, because we recognize that by the time diabetes is diagnosed, 50% of your beta cells in the pancreas are already dead. And so your body is already beginning to resist insulin. Sometimes you can see early signs that your body is actually resisting insulin long before you become diabetic. And here is where I'm pointing to young ladies. There are young ladies who have serious hormonal imbalances that can cause caused by polycystic ovarian syndrome, infertility, not able to get pregnant, having problems with their uterus. There is a sign at the back of the neck, a darker sign that is called acanthosis nigricans. And that's an early sign that that young lady is experiencing insulin resistance. That young person should know that they are right on the track of developing diabetes, and so their life has to be changed, because bet your bottom dollar at some stage you're going to become diabetic. And so this is an early sign. So there are different types of diabetes. The type 1 diabetes is where your body does not produce insulin at all, because for some reason your body destroys the insulin that you produce. This is called type 1 diabetes, and it generally happens when you're much, much younger. In fact, most people with type 1 diabetes are actually born with it. It's an autoimmune disease where your immune system simply fights your pancreas to stop it from producing insulin. But if it does produce any insulin at all, this insulin is not useful. And so these patients almost always have to be placed on insulin at a very early age. Type 2 diabetes is the difference, where your body functions normal. Your body is able to use the insulin at some early stage, but later on in life, it starts resisting the insulin, and this can cause a problem. There's a term that we use sometimes that is called pre-diabetics. I don't like it that much because I think it can give a false connotation, but still, it is a term that is generally accepted in the medical fraternity. This is when your blood sugar is higher than normal, but is not enough to actually be diagnosed as classic diabetes. Sometimes a doctor might use a different term, might say glucose intolerance, as a term to say that you're pre-diabetic. Even the HbA1c that is now done, you can get a number of the HbA1c level, a level that kind of indicate that you're pre-diabetic. Being pre-diabetic is potentially a reversible type of diabetes, because by simply making behavioral changes, you're actually able to reverse that diabetes. And then type 2 diabetes, as I told you earlier, your cells become resistant to insulin later on in life. And as I said, for young persons who have polycystic ovarian syndrome, that's an early sign that you are going to resist insulin, and that can cause you to have diabetes later on. With men, it's a bit different. With men, you actually have to look at the back of the neck to see if they themselves also have acanthosis nigricans. And that is something that tells a man that he is resistant to insulin. Gestational diabetes is another type of diabetes. It happens in women who are pregnant. And for gestational diabetes, because of the hormones that is produced in the placenta, it actually makes the body resistant to insulin again. And because it's resistant to insulin, the insulin is not functioning well, and that causes your blood sugar to go up. The hormone that is produced is called beta-HCG. That's the name of the hormone in the women that stops or makes the insulin resistant. Very important to recognize that any woman who have had gestational diabetes or diabetes during pregnancy has an increased risk. As a matter of fact, the books put it that you have a 50% chance that you are actually going to convert to genuine outright diabetes later on in your life. And so similar for hypertension, ladies who develop hypertension in pregnancy or diabetes in pregnancy have to remember that they could develop real diabetes later on. In fact, half of the times they actually will do that. I don't know what's happening with the education system these days, but over the last couple of weeks, I've actually seen a number of women who are coming to me with high blood sugars, who had gestational diabetes, who said that they were not told that they have a chance of developing genuine diabetes later on. Whether their memory is failing them, I don't know, because I can't understand why would they not be told that, because that is normal part of education in antenatal clinic if someone developed gestational diabetes. Gestational diabetes, again, is a reversible type. If it happens in pregnancy, then you know you have a chance of having it. So you know how to do what you need to do to prevent yourself from converting into real diabetes. People love to ask that question, what are the symptoms of diseases? And I generally answer it by saying that there are no symptoms of disease, because for most diseases that I know, when they start, they do not have any symptoms at all. You only get symptoms of a disease when your body starts having complications of that disease. That's when you know you have, that's a lot of the time, that's when we know we have a disease. So I generally do not like answering that question. I think people should get themselves checked because they know what the risk factors are and stop waiting for symptoms of it. Sometimes I feel people want symptoms because they want to know how far they can push the envelope. They want to be able to do whatever they want to do. And when they start seeing symptoms, then they realize, okay, I need to backtrack now. And that is a really bad approach that we have to have. But for those who do experience symptoms, the symptoms are going to always dependent on how heavy or how high the blood is. With prediabetes or type 2 diabetes, there may be no symptoms initially. Some signs and symptoms of type 1 and type 2 are similar, but the general ones are increased thirst, frequent urination, extreme hunger, unexplained weight loss, and blurred vision. I have had so much experience on opportunities, or maybe experience is a better word, where people develop blurred vision. And they actually, instead of going to the physician, they actually went to the optician to get the eyes checked, thinking that they may need glasses. And sometimes, depending on the optician or wherever they go, the optician may or may not tell them that you need to get your blood sugar checked. But one way or the other, they leave there with their glasses anyway. They may even get one for reading, or even if they don't have an optical problem, in other words, the eyes is fine, but of course, people need to make money. So, and some of us love spending money too. So you leave with the glasses anyway. But you get your eyes blood, you need to get yourself checked by your physicians first. Some people who have frequent infections like skin and gum infections, and in particular, yeast infection of the vagina, repeated or recurrent yeast infection of the vagina is also a sign of diabetes. Are you at risk for type 1 diabetes? Well, for most of us who are now in our adult years, probably we don't have increased risk of it now because we would have had it anyway. But for an unborn child or young children, they are at risk of type 1 diabetes. What causes type 1 diabetes? What causes our immune system to suddenly start affecting the beta cells of our pancreas that stops insulin production? We really don't know. There are some school of thought that it might be virus related, but we really don't know. We do know, however, that there is a strong family history of type 1 diabetes. So if someone else in the family has had type 1 diabetes, there's a great chance that you may have type 1 diabetes as well. I must say to you also, and what I'm going to say may be controversial, but I think sometimes we need to try to speak controversial, just encourage the national conversation on this issue. Make no mistake about it. The science of medicine is not interested in knowing the cause of anything. Pharmacology, vaccinology, virology, these studies, biology, they're hardly interested in knowing the cause, because knowing the cause can lead to cures. And in medicine, a lot of what goes on in medicine does not focus on cure. Now, we as a people, we want to live how we want to live, do what we want, live however we want to do, eat whatever we want to eat. And when we get diabetes, we want some magic way of getting better. There is no magic way. And that kind of behavior is also responsible for some other types of diseases that we have. So I'm hoping that these types of sessions and things like today would help us to do some kind of a personal soul searching to know that we have to take control of our health and not leave our health to some pharmaceutical companies and have big companies use our money and so on. That is a discussion that you have to have on yourself. Now, type 1 diabetes, as we indicated earlier, there might be antibodies that is affecting the beta cells of the pancreas that is somehow making our bodies resistant to the insulin. We have noticed, however, there are some dietary factors, including low vitamin D consumption and early exposures to cow's milk or cow's formula before the age of 4 months. You know, I looked the other day, a company donated formula to the maternity unit in St. George's, in the General Hospital. The thing actually made news. It came on news that the company donated milk to the maternity unit. I don't know where our minds and our brains have gone. I don't know what factors are forcing us to do this kind of thing, but somehow there's an underlying current that seems to constantly make us make the wrong decisions all the time. And we are clueless about it. Look at what is happening with the vaccinations. There's an underlying current that forces people to do the wrong thing. And somehow that kind of a force is making us feel as though that wrong thing is correct. The hospital and that company should have never promoted that, because this goes against what is healthy for children and babies. We now know that chronic disease is almost certainly going to happen to an adult once that adult was exposed to cow's milk earlier in their days. Now, the low vitamin D consumption, that part should be looked at, or that part is important for other countries that don't have as good sunlight as we do. We have good sunlight here, so we really don't need to consume vitamin D per se. We have enough ultraviolet rays to help our kidneys to convert and make our vitamin D for us. So that really shouldn't be a problem for us. Type 2 diabetes, are we at risk for it? Well, the total cause of type 2 diabetes is not fully understood, but we have a generally great idea what causes it. Weight and inactivity. It is very clear that people who are on the higher range of weight tends to have more risk of diabetes. We also know that people who are inactive tends to have more diabetes. We are further aware that people who have family history of diabetes tend to have it. In my own family, all of my aunts and uncles on both sides of my parents are already diabetic. Every one of them, including my mother, she's diabetic. And in my generation, all of those, my cousins who are older than me are already diabetic. And I think 1 or 2 younger than me are already diabetic. So I know for sure that I am at risk of it, diabetes. And that's one reason why I check myself very often. Race also tends to play a part. For some strange reason, it seems that most diseases that we know of men are more common in Blacks and Hispanics. Whether or not this is corroborated, that's another story. I didn't do that studies, but I just find it interesting that most of the diseases that we know is increases in Black people. If you've had gestational diabetes, as I said earlier, you have an increased risk of getting diabetes later on. If you have a very heavy baby, more than 9 pounds, that increases your chance of diabetes. Here we go again, polycystic ovarian syndrome, irregular menstrual period. You heard me speak about it earlier. If you have those issues, you are right on the pathway of developing diabetes later on in your life. Now, I like to call this the 3 stooges, because those 3 things almost always happens together: high blood sugar, high blood pressure, and abnormal cholesterol. So people who have abnormal cholesterol, I will tell them, check that pressure and sugar, because chances are you're going to be developing it later on. Those who have high blood pressure, I will similarly say to them, chances are you're going to have high cholesterol and diabetes later on. So keep checking on that. They always tend to happen with one another, and you always have to be consequentious. You could have complications due to these things. So what are some of the complications we're talking about? Cardiovascular disease, heart attack, strokes. And that is because diabetes causes problems by creating damages inside of the blood vessels. Now, if you think of the blood vessels as a PVC pipe, the inside of the PVC pipe where the water runs, the diabetes causes damages in the walls of those pipes. And as the pipes makes an attempt to correct or repair the walls, that leads to scar formation. And as the scar being formed, the cholesterols that you eat, the cholesterols that we love, the cholesterols that we will do anything to get, the cholesterol that we will hate the government for if the government says stop eating it, that cholesterol that you so much love that you would kill to get, that cholesterol starts depositing on the inside of the blood vessels where the damages were. And that leads to blockages within the blood vessels. And as you can see, blockages in the heart would cause angina and heart attack. Blockages in the brain is going to cause strokes. And there you see the link between high blood pressure, diabetes, heart attack, and strokes. Nerve damages. That's another complication of diabetes. And by the way, nerve damages are not the first complications of diabetes. It's a very late complication. So there are people who came to me because they're feeling numbness in their feet and their hand, and they will say, doctor, I feel numbness in my feet and my hand. I come to see if I have diabetes. Generally, that's not the case. To get nerve damage from diabetes means you would have had uncontrolled diabetes for many, many years, maybe decades, before you actually start having nerve damage, that kind of nerve damage. So a nerve damage like this is going to generally be a genuine nerve damage at the level of the skeletal system or at the level of some other blunt traumas. And the nerve damage associated with diabetes is usually called the glove and stocking phenomena. That means the person feels the numbness in the hand up to where a glove is supposed to be, and in the feet from the toes up to the knees or the calf muscle where stocking is supposed to be. So it's called a glove and stocking phenomena. Now, nerve damage in diabetes can also lead to erectile dysfunction. As a matter of fact, a nerve complication in diabetes in a man that has led to erectile dysfunction generally means there is no turning back. In the man, he will notice that he's having erectile dysfunction long time before he starts experiencing a nerve damage. Because not only does diabetes eventually affects the nerve, remember I said earlier that the diabetes interferes or damages the inside of the PVC pipe or the inside of the blood vessels. When that happens, because erection depends so much on good blood flow into the penis, that blood flow gets reduced. And so even before the nerve is damaged, the man will realize that his erection is not as long as it used to be, is not as firm as it used to be. And unfortunately for men, especially us, for men in the Caribbean, when that starts happening to us, there is a psychological battle that goes on in your head. And by the time the psychological battle gets there in a week or two, before you know it, that penis is gone, is dead. So that's another serious discussion we have to have with our men folk to let them know, don't let your brain mess with your erection. And don't wait for the nerve to start getting damaged. We can fix the erection long before the nerve starts getting damaged. So I really hope that this time around on World Diabetic Day, that there is some level of frank discussion for our men folk who for too long have been suffering in silence because of that erectile dysfunction issue, leading to now one of the most successful drug ever created in human. The people who created the drug actually got, was it a Nobel Peace Prize? I think it was. The makers of Viagra. Viagra has been the drug that has paid for itself the fastest in the existence of human being. That drug is successful like crazy. And that is because men for too long have been suffering in silence. And I really hope as we have Men's Health Day coming up, I hope that we can have a national discussion on this matter. But anyhow, I digress. This is not the time for that particular issue. Food damage. Food damage can also occur because of diabetes. The nerve get damaged. If the nerves get damaged, your foot don't feel as you're supposed to feel. And so you can get cuts, you can get blunt trauma, and that can lead to food damage. And if you don't know, it gets infected, and later on the infection can actually lead to you damage in your foot. All right, so damage to the major organs of our bodies by the diabetes is what can lead to serious problem. Now, everyone knows that with diabetic, Kidney health is one of the most important things. I think everyone is aware of that. What you also need to recognize is that kidney health and eye health goes hand in hand. So if there ever a diabetic who has developed any kidney problem, we are 100% sure that that diabetic is also developing eye or has also developed eye problems. And if there are any diabetics who have developed eye problems, we're also 100% sure that they also have developed kidney problems, because eye and kidney problems go hand in hand. Diabetic foot ulcer is one of the major issues that is causing amputations. And over the years, we collected some data for the last 10 years. I think that was data collected from 2001 to 2010, which showed a consistent increase in amputations from diabetic complications. I don't know what the latest data is like, but it became so concerned that the ministry actually started prioritizing foot care as one major issue for diabetics on the island, because amputated foot can cause serious psychological problems, social problems, economic problems, just to name a few. And it's really unaccepted at this stage. Diabetic retinopathy, as I indicated earlier, these are where there are small bleedings at the back of the eye because the blood vessels rupture. Hypertension can do that as well. This is the reason why diabetics have to get their eye checked all the time, especially if they get their kidney test and you realize that your kidney function is going down. You really have to get your eye checked as well, because we're 100% sure that if your kidney function is going down, your eye function is also going to start going down. Complications of gestational diabetes. We won't spend a whole lot of time on that, but excess growth. The baby grows much, much bigger than it's supposed to be. And because of that, the baby after birth may experience low blood sugar because the insulin in that baby would have been too high because the mother's blood sugar was too high. Later on in life, type 2 diabetes can lead to death. It can cause preeclampsia, which is a high blood pressure, the protein in the urine, and generally if that happens, the doctor will do a cesarean section and take the baby away, because that person can actually die as a result of the blood sugar. Are you at risk? I don't think of the 41 persons who are here on this call today, I believe that none of you are at risk, because I believe that none of you engages in that kind of food. So I'm not worried about you, because you are already deconverted, I assume, right? That's why you're here, right? So I put this up just to tell you that you need to bring that message over to other people. There's a few things about that slide, that picture that I've just shown you. This picture elicits a kind of a urge and a want in your brain that you don't even understand. This has in it high fructose corn syrup. High fructose corn syrup is found in every one of what you're seeing on the screen. High fructose corn syrup was genetically modified to produce a special type of fructose that is used to sweeten all foods there is, most foods that is on the face of the earth, and has found itself in almost all of the other foods that we eat. High fructose corn syrup, when it gets into the body, it is metabolized by the liver. High fructose corn syrup is metabolized the exact same way as alcohol is metabolized in the liver. In other words, high fructose corn syrup does the same damage to the liver as alcohol does. It's just that high fructose corn syrup does the damage at a much slower rate than alcohol. So the next time you decide to look at a man drinking alcohol and turn up your nose at him, ask yourself, have I drank a fizzy drink during the course of the day? If you did, then you know better than the alcoholic. It is just that the alcoholic is going to suffer less because he's going to die quicker. And you might suffer no, because of course, diabetes is going to take one organ away at a time from you until you eventually die. So yes, we are at risk of this issue. The other thing we need to look at is glycemic index. Glycemic index is a term that is used to determine how high your blood sugar goes after eating a particular food. So foods that gives you high blood sugar after eating, they're called foods with high glycemic index. And food that does not increase your blood sugar after eating it, they're considered food with low glycemic index. And so these are an example of things with high glycemic index and low glycemic indexes. Look at the high glycemic index. Look at the first word in high glycemic index category, Irish potatoes. Irish potato is almost a staple in Grenada. None of us should be eating Irish potato. And as a matter of fact, right now, they're genetically modifying the Irish potato to produce a lot more amylase, which is a special hormone that our body uses, a special enzyme that our body uses. The Irish potato brings your blood sugar extremely high. Sweet potato, on the other hand, which is a little sweeter, is considered a complex carbohydrate. So sweet potato is a medium glycemic index. So sweet potato is better to eat than Irish potato. Look at high fructose corn syrup. High fructose corn syrup is a high glycemic index food. In other words, colleagues, you and I are eating our way towards diabetes. We're doing it literally every day. Pasta, cereals. I usually say to us, white is bad for us. White is bad for Black people. White is bad for Black people. White rice is bad. White flour is bad. White pasta is bad. White is bad for Black people. We have no reason to be associating with anything white. Now, you could take this however you want, that's up to you. But white is bad for us. All right. Sweetened fruit juices. You know, even going to the shop and buying a box of orange juice. Now, when you and I suck oranges, how much oranges do we suck? We may suck one, or we may suck two. Some of us suck half of an orange. Those of us who live with certain people in our houses who don't like to see us eat something, by the time you peel the orange and you cut half, somebody else in your house take the other half. And I think you know what that means like. But when you buy a box of juice, have you ever asked yourself, how much oranges did it take to fill that box of juice? Most of the time, it's more than one orange it takes. Sometimes 5 to 10 oranges to fill that box of juice, but you drink the entire box. So this is something you got to think about. Sweetened juice, or the type of juice that you use. Look at the foods with medium glycemic index: sweet potatoes, orange juice, and honey. And this is why sometimes diabetics would use honey to sweeten their stuff rather than sugar. Well, the low glycemic index food, I mean, the writing is on the wall right there. You see it. Yams, the sheen, tanya, the carrots. In other words, the foods under the ground is better than the foods above the ground. And do you know something? I was doing a diabetic discussion for a church one day. And just for discussion, I decided to go through the Bible and see the foods that Jesus Christ ate when he was on the face of the earth. Do you know that Jesus Christ, all the foods that Jesus Christ ate when he was on, well, all the documented foods that Jesus Christ ate when he was on the face of the earth, they all are low glycemic index foods. I found that rather interesting to have seen. It was a wonderful piece of, investigations I did to see the pomegranates, the food that he talks about. They were all low glycemic and to a certain extent medium glycemic. So Jesus Christ knew something about diabetes, if you know what I mean. So it's time for us to take a page out of that kind of book as religious people, as we call ourselves. So glycemic index and appetite. Take a look at this next slide that I'm going to show you. Watch it very carefully because in there is a lesson for us. Now, look at two sets of people. One person would have eaten the Western type of breakfast. That's the food that we see on television. That's the food that we believe we should be eating now because we're more affluent. As a matter of fact, we want to behave like Americans now. So we want to eat American breakfasts. I have seen this thing called waffles in my house. I never grew up on waffles. I don't know what that thing is. I see this thing called pancake. Who know about pancake? We all want to start to eat like, I don't understand this, maple syrup. Anyhow, that's not how we grew up. I don't know where we got that from anyhow. So look at this breakfast here, this American type breakfast that we have here. One person ate this breakfast. And then one person eats that, on the other hand, is the good old Grenadian breakfast. You know, some blogger, yam, whatever you want to call it, the good old bakes and fish cake, you know, steamed jacks, whatever it is, the Grenadian breakfast on that side here. Now, follow the red. If in the morning, that person ate their breakfast around 7 o'clock or 8 o'clock, the person who ate the American breakfast, that's the American breakfast, the blood sugar goes up, the high glycemic index is so high. By 10 o'clock in the day, your blood sugar, 9 o'clock, 10 o'clock, your blood sugar is very high because you ate food with high glycemic index. Look at what happens as the hours go by. The blood sugar starts to drop in your body, blood starts to drop in your body. By the 4 hours, which generally is lunchtime, because generally we work from 8 to 12. So 8, 9, 10, 11, 12, 4 hours. By 4 hours, the blood sugar in your body has dropped so low that you get hungry. You must get lunch. You have to go get lunch because you're so hungry. On the other hand, the green represents the Grenadian breakfast. The Grenadian breakfast, look at how the green stays stable right through the morning session. Right through the morning session. At lunchtime, you may eat because it's lunchtime, but you're not as hungry as you would have been if you ate the American breakfast. And so that is the difference between the glycemic index. And worse yet, those who ate the American breakfast, if at lunchtime, when they're so hungry, they made the same mistake and go back and buy things from a restaurant, or they buy something, they buy a chicken in a red and white box, or they buy some kind of food like that. The same thing is going to happen. And so by the time they get home in the evening at 4 o'clock, 5 o'clock, they're so hungry, they have to go back and eat. So a word to the wise is sufficient, colleagues. Eat the local Grenadian foods. By doing so, your blood sugar continues to stay stable in your blood all day. So you don't feel the hunger, you don't feel the thirst for this food, you don't feel the urge for it as you should. But then again, who is me to speak? Management. How do you manage diabetes? Well, I'll tell you something. I never put anybody on blood sugar medication when their sugar is diagnosed. Well, I shouldn't say that, depending on how high the level is, because I have seen some people at the diagnosis of diabetes, the blood sugar is so high, the machine can't even measure it. The machine simply have to the machines give up and they say hi. The machines give up. The machines just say hi. You know, some machines you can see 100, 200, 300, 400. Some machines can't count it. It just says hi. So for those people, I'll have to give them the medication to start with. But generally, I recommend that you work hard with your diet. We'll do counseling. We'll do all sorts of things. We check blood sugar every morning and make certain differences before you go on. So diet and exercise is an excellent way. We should exercise at least 3 to 5 times a week for at least 30 minutes a day. I mean, these are things we know for ages, for years we've been saying that. We don't need to go over that again. But of course, there are oral medications that we can give. We can give insulin, we can give metformin, Janumet, Januvia, Diamicron, all of these things we can give as oral medicines. But of course, insulin remains a major part of what we do, because recall I told you that by the time diabetes is diagnosed, about 50% of your beta cells in your pancreas is already dead. So that insulin production is very, very low. And so the modern way of thinking of treating diabetes is to transfer people to insulin at a much earlier stage than what used to be happening before. In the days gone by, the doctors used to wait until water more than flour before they put someone on insulin. These days, that is not the case. So this is where I'm going to leave it for now, because I believe there are loads of questions that you may want to have answered. And I like answering these questions. So I am going to leave it here for now and open the floor to you for any questions that you may have. Thank you very much. Over.
Thank you so much, Dr. Martin. Now, you gave us such a wealth of information there. I'm almost certain that the question is going to be very limited because it was crystal clear to us as best as possible. But nonetheless, I'll give you 2 minutes to take a break. And let me just give persons an idea of what Lions Club of St. George's have been up to with regards to diabetes projects. We'll just give a presentation at this moment for persons so they can see the activities that we have been doing within our communities. Thank you so much. Thank you so much. At this point, we are going to open the floor for persons who may have questions for Dr. Martin or Diabetes Association or Lion Joy. We would see how best we can answer the questions. You can either raise your hand so that we can encourage you to unmute, or you can type your questions in the chat and we will go ahead with the questions. Okay, we have our first question from Lion Deborah. Go ahead.
Okay, this question is for Dr. Martin. My grandfather was, he had high blood pressure, high blood sugar, right? And that kind of shocked him and he stopped using all sugars. And eventually he had low blood sugar and he died from low blood sugar. My question is, how dangerous is low blood sugar as compared to high blood sugar?
All right, well, first of all, we need to fix the story a little bit because it is impossible to die from low blood sugar. If, however, he was on blood sugar medication and he took the blood sugar medication and the blood sugar medication dropped the blood sugar so much that he got into a coma and died, that makes more sense than if he just died from low blood sugar simply because he stopped taking sugar. Because when you stop taking sugar, in order for your body to continue to live, your liver changes your fat into sugar so that your brain can live. And when it changes all your fat and you get really skinny, for your brain to continue to live, the liver now takes the muscles of your body and turns the muscle into sugar so that your brain can live. In other words, there is always a mechanism in the human body to keep the blood sugar up in the body so that the brain can survive. So it's impossible for a normal human being to die from low blood sugar. It's almost impossible for a normal human being to die from low blood sugar. However, if someone who has high blood sugar was taking blood sugar medication and you took the blood sugar medication can drop the blood sugar in your body to such an extent that you become in a coma and you can die from it. I hope you understand me. You need to unmute.
No, I was saying he didn't die from a coma or in a coma.
He died from?
Well, the story was from my mom that he died from the fact that he didn't used to use no sugar at all.
Oh no, that is kind of physiologically impossible. Because even for diabetics, by the time your blood sugar reached 60 milligrams of per DL, by the time your blood sugar starts going to 60 milligrams, 50 milligrams, then you start getting very lethargic and your eyes start, by the time you get to 40 milligrams, you're already unconscious.
Okay.
But that's for people who are on the medication related to blood sugar. Because once you're not on medication that drops your blood sugar, your liver will constantly make new sugars for you every minute of the day to keep your brain alive. The process in medicine, it is called gluconeogenesis, meaning that the gluco means glucose, neo means new, and genesis means the beginning of, the making of. So the liver does something called gluconeogenesis by first of all using the fat under your skin and turn it into glucose. And after you get small and all the fat gone, then it turns to your muscle and turn your muscle into sugar so that your brain can continue to live.
So let me just ask my final question. People who have high sugar level, right? I know like somebody who has, who's diabetic, they will have a glass of ice cream and then have a glass of water, right? How effective is the water to having the glass of ice cream when you're diabetic?
What? Anyhow, the water makes no difference. But anyhow, what I like to do sometimes is to having diabetes is already such a difficult thing to have, especially if they're on tablets. So generally for diabetics, I would say there must be ways to reward yourself. I have no problems with a diabetic having a glass of ice cream, but you must be knowledgeable of what you're doing. Now, if you are on tablets, it is much more difficult to monitor and to regulate your blood sugar if you are on tablets. So that glass of ice cream is going to cause your blood sugar to rise, and there is nothing you can do about it if you're on tablets, that is. However, if you are on insulin, that's much better, because as soon as you have your glass of ice cream, 2 hours after that, you can check your blood sugar to see what it's like. And if your blood sugar is high, you can simply adjust your insulin. So insulin makes life easier for a diabetic. Listen, that's how I got my mother to go on insulin. She was very adamant, no insulin, because in her days, when you go on insulin is when things real bad. That's when you go on insulin. But she didn't realize that these days, the doctors are now turning things around. We're saying go on insulin earlier to delay renal failure. The earlier you go on insulin is the more you delay renal failure. But my mother has a problem with mangoes. During the mango season, I cannot control my mother's sugar. She hiding and suck the mango. Sometimes she get up 3, 4 in the morning and hide and suck the mango. So we made a deal. I say, Mom, I can handle this much better if you go on insulin. So I will let you suck the mango, and we simply adjust the insulin to keep the sugar under control. Well, stories sell good. Mommy on insulin now, and sugar well controlled.
All right, thank you.
Hello, Dr. Martin.
Hi.
Hi. So there is a question from Bernice that is closely related to the comments that you just made. Her question is, can a person return to tablets after placed on insulin?
Yes, you can. You can go from tablets to insulin and from insulin back to tablets. It depends on the control that you have. It depends on how well motivated you are to control your sugar. Depends on your other underlying issues that you may have. It's not a one size fit all, but you and your physician will work together to make this thing happen. But yes, going back and forth is possible.
Okay, so let's zone in a bit on the diagnosis and treatment of diabetes. Can you break it down in layman terms for us? What is meant by A1C?
A1C, actually, it's incomplete. It has to be spelled HbA1c. I hope that's what the person wanted to.
Yes. So
right.
Can you break that down in layman's terms for us?
Right. HB means hemoglobin. All right. HB simply means hemoglobin. And A1C is just the name given to that particular gene, that particular blood cells that we're looking at. So it's a hemoglobin cell that we're looking at. The physiology here is that we have noticed that blood sugar tends to attach itself to the hemoglobin in our bodies. The hemoglobin is a red part of our blood, right? So by measuring the amount of sugar that is attached to the hemoglobin, that helps us to determine how well controlled the sugar is. So that's what HbA1c means, hemoglobin A1c. That's just the name given to the particular cell that we use to measure. Now, HbA1c is a very important test. Now, we know that there are some cheaters in diabetes. They do not control their sugar. They eat all what they want to eat. But when they know they have to go see the doctor tomorrow, the day before, oh my God, they're eating good. So by the time they get to the doctor's office, the blood sugar looks good. When the doctor sends them to do the fasting blood sugar test, The day before they go and do the blood sugar test, they're eating good. So by the time they do the blood sugar, the fasting blood sugar is normal. HbA1c finds out those cheaters, because what HbA1c does, it goes back 3 months and it takes an average of what your blood sugar was over the last 3 months. So the HbA1c doesn't lie. It can tell you if you were cheating and your blood sugar was being high for a while.
Thank you for that. We have another question. So during your presentation and during your remarks, you gave us some information in terms of risk factors and person's family history. This question relating to that topic in terms.
We lost you for a bit, Lantia. So
Sure.
We didn't hear the question.
Okay, and let me repeat. Sorry about that. Is there a correlation between diabetes and anemia?
Yes, there could be a correlation. Not necessarily, but a correlation in terms of checking the control of your diabetes. As I usually say, once a human being have one disease, there's always a chance they can get another disease because your immune system is under attack. So if you're anemic, your blood is low, your immune system is under attack, and that makes it easier for you to get other diseases, including hypertension, diabetes, and cholesterol, and so on. But where anemia becomes important is in the testing of the HbA1c. Because remember, that is blood sugar that is attached to the red blood cells. And anemia is a disease caused by decreased red blood cells. So when your doctor orders an HbA1c for you, he will also order your CBC, which is a complete blood count, to look at the level of anemia. Because if you are very anemic and your HB is low because you're anemic, then the HbA1c might also be low. And the doctor may say the HbA1c is normal, is low, so you're controlled. But no, you may not be controlled. The HbA1c might be low simply because you were anemic in the first place. So the HbA1c and the anemia goes hand in hand to determine whether or not the HbA1c is a genuine result that you're looking at, or whether the HbA1c is simply normal because your HB is low. So I think that's the correlation. And if I confuse you, I'll be more than happy to go back again and repeat, because I know sometimes these things can be a bit confusing.
Thank you so much. And yes, you have answered that very well for us. Let's continue in terms of the treatment. So we would have talked about the insulin and the tablets. In terms of insulin, can you explain that type of treatment?
We lost you again.
Sorry about that, my internet. Can you explain insulin, the treatment or the use of insulin?
Insulin, I'll make an analogy. Insulin is your mother. Diabetes, blood sugar is the child. When the mother goes into the house, she holds the child by his hand and walks the child into the house. The mother comes from town with her child and she goes into the house, which is the blood cells. She holds the child by his hand and walks through the door into the house. Insulin is like the mother. Glucose is like the child. And the blood cells in our body is the house. So insulin holds sugar by its hand and walks through the doors to enter the cells of our bodies so that our bodies can use the glucose. And that's what causes the blood sugar in the blood vessels to drop.
Thank you for that. So we have another question, and I know you gave the your personal experience in terms of mangoes. This question is regarding drinks. Is there any truth that whiskey is a better drink for diabetics?
Oh my goodness.
And if yes, why?
Whiskey.
So as you can see, Dr. Martin, there is so much information and misinformation out there. So that's why it's so important that you're joining us here to clarify.
Right. Well, the issue is not whiskey. The issue is alcohol. That's what it is. It's not just whiskey, but alcohol. The alcohol that is closest to medicine is vodka. As a matter of fact, in the days gone by, we used to use vodka to sterilize medical equipment. That's the days before sterilization. But generally, alcohol tends to increase blood sugars. How the alcohol is made, it can be different, but generally alcohol tends to increase blood sugars. And not just blood sugars, but your triglycerides or your cholesterols can also get affected by using alcohol. I am not sure of any specifics between whiskey and diabetes. I'm not sure of that at all. If that person has any inclination, I'll be happy for them to link me up after the show if there is something specific that that person and I can work through, because I myself would like to learn if there is some relationship between whiskey and blood sugar. But generally it's alcohol and blood sugar, not just whiskey. And alcohol generally brings up blood sugars because of how it's made.
Sure. So I have made a note and I can put you in contact with that person afterwards. Thank you. The next question. Can diabetics on insulin take zinc tablets daily?
Well, diabetics on insulin can take zinc tablets daily, but there's a couple caveat here. Zinc has certainly shot itself into the limelight because of COVID. Because what zinc does, zinc opens the passageway or the channels in our cells so that the hydroxychloroquine and the ivermectin can stop COVID from multiplying. Zinc itself does not interfere with COVID, but it opens the channel so that the hydroxychloroquine and other things can stop the production or can stop the multiplication of COVID. So that's what zinc does in 50 milligrams. After that, you can continue to take a 25 milligram zinc. However, there's something very important to know. Pharmaceutical zinc, or the zinc that you buy in the pharmacy, can increase your blood pressure. However, dietary zinc, or zinc that you get from normal dietary intake, does not interfere with your blood pressure. Goes right back to the thing. You eat local, eat normal, that's good. So the zinc that you get from the foods that you eat does not interfere with your blood pressure, but the zinc that you buy in the pharmacy can interfere with your blood sugar. And that's why it's very important that you understand and you control your blood pressure if you are someone with high blood pressure. The best sources of zinc that we have here now is pumpkin seeds. You can get a lot of zinc from that. And I think this is probably where Lambie and CMOS get their mysticalness from, because you can actually get some zinc from that as well to help in terms of sperm production. These things don't help erections. When fellas figure they're eating Lambie to get erection, that does make no sense at all. But it does help with sperm production. The other thing you can do is to have vegetables in your backyard that was grown without use of fertilizer. Your vegetables grown without use of fertilizer also has a high amount of zinc in it that can help the man to feel much better, and generally for people to feel much better. So I hope that answered the question.
Yes, perhaps you can just share a little bit for us in terms of the treatment protocols for someone who is diabetic and has contracted COVID.
All right. The treatment protocol for someone with diabetic that have COVID will be dependent on that particular person. If you're asking me, is there a strict guideline that everyone who is diabetic and COVID will be treated? The answer is no, there isn't. because every case must be taken on a case-by-case basis. There are some basics, however. The basics, number one, you will be put on zinc because zinc would help with the treatment of COVID. Number two, you'll be put on vitamin D. The reason you're being put on vitamin D is not just because you need the vitamin D, but because COVID causes you to have to stay inside, away from the sun for an extended period of time. And so your body gonna need additional vitamin D to help the immune system to function. And then the third would be dependent on what symptoms you're having. Some people have fever, headache, others may have cough, some may have pneumonia, others may not have pneumonia. So if you have pneumonia, the doctor will put you on ceftriaxone, azithromycin, hydroxychloroquine. If you have not had pneumonia, a doctor may choose to give you ivermectin to help you to stay out of hospital. If you're having severe difficulty breathing, he may also put you on a steroid called dexamethasone. So there is really no one size fit all for a diabetic. What we want to say, if you know you're diabetic, try your best to avoid getting COVID in the first place, because COVID, from the beginning of time, COVID has been very, very unfair to diabetics. It seemed as though COVID was gunning for diabetics, especially those with kidney failures or kidney diseases. So like I said, there is no one size fit all. It is always going to be a case-by-case basis based on your other medical conditions that you're having. Your doctor will choose to put you on treatment option A, B, or C.
Thank you for that answer. So generally, our medical professionals, such as yourselves, see an increase in persons visiting the offices or the hospitals just after the festive season, such as Christmas. With our Christmas season approaching, what advice can you give us, persons who are diabetics or friends and families, in terms of our intake on the different foods and so on to help manage during this particular period?
You know, maybe I should answer this by just saying, don't eat anything imported. Just don't eat anything imported. Because sometimes we try to make this thing into a science that it does not necessarily ought to be. There is no magic. We've always said that eating simple and local is the best. Eating simple and local is the best. Less use of preservative, less use of refined sugars. And by refined sugars, we're talking about pastries and everything that's in a can or a box or something like that. Eat your vegetables that you grow around your house or that is grown locally. Eat your ground provisions that is grown locally. Those are really the best. People constantly try to feel as though there is some magic bullet out there to help them to deal with these issues. There isn't. I've said before in some conversations that I've had, if you really want to live healthy, all you need to do is to sit down and think of what your grandparents used to do, and that's it. Once you see what your grandparents used to do and you follow what they used to do, you'll be okay.
Thank you for that answer. We do have another question. So earlier you spoke about vitamin D and zinc. Can you speak more about vitamin C specifically for persons who are diabetic? So that is the natural form of vitamin C as well as tablets.
Yes, the vitamin C happens to be a great option. And before we get accidentally cut off, let me just say, I brought my laptop today as a backup. And because it was a backup, I did not bring my power cord. I've just gotten an alert that my battery is on a critical low level. So I should have maybe another 10, 15 minutes or so on the battery that I currently have. We'll see how far that will take us. As it turns out, the vitamin C is an easier option. There is great evidence that consumption of vitamin C is a good job, is something good for the immune system. Great antioxidants in it. It prevents you from acute infections. It promotes the immune system and supports the immune system. And in particular, stopping cancers. Vitamin C is excellent for that. Vitamin C is also water soluble, so you don't have to worry about taking too much of it. If you take too much of it, you simply pee it out in your urine and you'll be fine. So taking the vitamin C, whether you get it from the fruit or from the tablet itself, that's okay. You can proceed and go ahead and take it. The only thing is that for normal vitamin C consumption is 1 gram a day, which means 1 tablet a day. But in acute illnesses, depending on the type of illnesses, you may need 1 twice a day, not once a day. So that's the only difference there, but you can proceed and go ahead and do that.
Okay, thank you so much, Dr. Martin. I don't see we have any other questions coming in there. So at this point, let's just do a little wrap up on things. I would first ask Ms. Davis from the Grenada Diabetes Association, is there any 1-minute wrap up mentions you would like to make at this point?
Okay, Dr. Martin, as usual, welcome, well done. You know, you normally have me cracking up from one point to the other, and you haven't done any different at this point in time. My only thing here is to remind us that diabetes, for the most part, is preventable, and each and every one of us should do our best to prevent getting the disease. For those persons who may have it, control is the key word in which the person needs to follow the advice of their healthcare provider and take control of it. Once it's controlled, it means that all the other challenges either would subside or will become, you will, you know, live so long that you may never experience it. And to remind persons that the Diabetes Association is there, it's for support, for advocacy, for education. We have a number of trained individuals who could educate persons, educate one-on-one. So, you know, we need to, persons need to utilize the services that are there, just per chance they have a little question in between, and utilize it to the max. That's what we're there for. We're basically trying to prevent and control diabetes.
Thank you so much, Ms. Davis. Lanjoy, do you have any final words you would like to share with us?
Okay, I had as a diabetic myself and a person with a sweet tooth, it can be very difficult sometimes to resist sugary stuff. But I try very hard knowing the different areas diabetes can affect. So to keep my sugar levels under control. Therefore, I would encourage clubs, communities, parents, and everyone the importance of being educated about diabetes and how to live with it. So I want to thank you for allowing me to be a part of this virtual session as Assistant Coordinator, Diabetes for Region 3. Thank you.
Happy to have had you, Lanjoy. Thank you so much.
Thank
Dr.
you too.
Martin, any final words you want to leave with us? We got so many from you and we are so appreciative, but any final thing coming out from your office or from, you know, that you would like to tell us? You're muted, Dr. Martin.
We're going to be approaching the Christmas season, and it's usually one of the worst times for persons because of the lure of what happens at Christmas time. And I understand the social pressures, and I'm not a guy that don't believe people shouldn't have fun. We have to be able to reward ourselves from time to time. So I know Christmas is going to be a challenge. I never get annoyed with patients for not taking the medication every day. I never get annoyed because I know it's difficult. I just work with my patients to see how best we can get from point A to point B. So have a good Christmas. Do what you have to do. I know you're going to err on the side of a little sweets from time to time, and that's fine. Just know your boundaries and know what levels you need to go. Have some fun. If you're on insulin, adjust it and have a little cake because you need it. Because if the insulin can kill you, the stress will kill you anyway, because you see all the food and you realize you can't eat it. So what I'm saying, have some fun, but just adjust your medication to make it work well for you. One other caveat before you go though, and it has to do with salt. I'm particularly conscious about the ham. Now, the human being can survive on 500 milligrams of salt in a day. Just be mindful of the fact that one serving of ham gives you 3 times the amount of maximum salt your body requires in one day. Just be mindful of that. And if you're going to do this, be very careful. This is where the water comes in. The water comes in the salt. So be careful over the holiday. Do what you got to do. And in January, clean out yourself in January. And in February, go and get your annual medical checkup in February. Don't go in January. Those are my final words. Good night.
Thank you so much, Dr. Martin.